Okay, so we all know that when we classify ARDS into mild, moderate, severe, we use PF ratio, which is PO2 by FiO2 ratio. So if it is less than 300, we call it mild ARDS. If it is less than 200, we call it moderate ARDS. And if it is less than 100, we call it severe ARDS. So based on the PF ratio, PO2 by FiO2 ratio. But to calculate this ratio, we need ABG machine or blood gas report. So at times the hospital may not have a ABG machine. So this was the scenario we all have observed during the COVID era, where there were a lot of patients and many institutions were managing the patient and ABG machine were not there. So a PF ratio could not be calculated. So we came up with another indicator which is called Spo2 by FiO2 ratio, which is saturation, which we use by the pulse oximeter, and the FiO2 we can calculate if on the ventilator itself, or if it is given through flow meter, we can convert and calculate. So it's easy. But why SpO2 by FiO2 ratio is not the same as PF ratio? I'll tell you what is the SpO2 by FiO2 ratio. The reason is the SpO2 and the PO2 carries a sigmoid relationship. It's not linear. So we have oxygen dissociation curve. So what happens when your SpO2 drops to 90, the PO2 drops drastically in the blood. So that's why your SpO2 PF ratio, SpO2 by FiO2 ratio will be little higher than your PF ratio when you will calculate the severity. So what is it? So SpO2 by FiO2 ratio, if you calculate, if it is less than 315, it will be little higher than your PF ratio. If it is less than 315, you will call it mild ARDS. Now, if it is less than 235, not 200, if it is less than 235, you will call it moderate ARDS. And if it is less than 148, so not 100, 148, you will call it severe ARDS. You see, the PO2 drops significantly as compared to SpO2 in the oxygen dissociation curve. So that's why SpO2 FiO2 ratio is a little higher than PF ratio. Also, one important thing you need to see when you are calculating these ratios is either the patient is on NIV with at least PEEP of 5, or if you are using HFNC, the minimum flow, it should be 30 liter per minute. So we have provided adequate support. Even on that, your PF ratio or SpO2 ratio is not in range. So PF ratio 300, 200, 100, SpO2 by FiO2 ratio 315, 235, 148. So I hope this clarifies. Do read more about it.